Good afternoon, everybody, and welcome to today's session. You had been laboring past 3 hours to solve the 300 question paper, and I'm very sure that the whole journey was fruitful. You are able to catch up what are those topics where you are really going bad, and those topics which are really excellent. So you know very well, getting that power of discretion as to what are you best at and what are the areas where you need to improve is the whole secret becoming the topper in the NEETPG. If our Husna and many more who are all online, let's make the great beginning. A 57-year-old, can you please punch whether the voice is loud and clear, everybody? On physical examination has 120/70 and the CT of the pelvis has been shown to you. So what is this? So it is a solid tumor with cystic spaces, So that is very classical of endometrioid tumor, which constitute about 20% of all the ovarian cancers. 65-year-old woman has a vaginal bulge, and that is appearing when she is heavily straining during defecation. She underwent a diagnostic test, and typically this is the finding. This is the finding that you are able to see. So what is your diagnosis? It is an enterocele and she required Moskowitz repair is what you should remember. So classically, the double arrows that are being shown here indicate a prolapse. You can see here, right? So Moskowitz is a purse string suture which is starting from below, and it is used to obliterate the cul-de-sac of the pouch of Douglas. That's called Moskowitz procedure, which is done to manage a case of enterocele is what you should remember. A lady who has got infertility and her laparoscopic finding, which is showing presence of a lot of adhesions, which are classical feature of pelvic inflammatory disease. Infection of which gland will typically lead to these classical findings when you are doing the pervaginal examination. So it is the Skene's glands. Skene's glands are the periurethral glands, which are tubulo-alveolar structures along the dorsolateral aspect that drain into the distal 2/3 of the urethra is what you need to remember. So it typically leads to suburethral cysts, abscesses that can rupture into the urethral lumen. So periurethral gland infection, the Skene's glands or the periurethral glands is what you need to remember. Good to see Ammaji, Nagreddy and 24 of your classmates. So please punch into the WhatsApp group. I'm also asking our helpline team to mention in all WhatsApp study groups that the live discussion started. Yes. So that many more can come back from the lunch. Chinnappa Reddy is asking, sir, how to access online MBBS video library? Right, so please call 9000-868-356. They will give you a 2-month subscription with which you get an access to 1,000+ hours of videos, 2 lakh PowerPoint slides, and full-scale grand tests, and the discussions, everything. You get it in the onlinembbs.com video library So please call our helpline to get an access for the next 2 months. Now, doctor, this is classically candidiasis, which is showing the white blocks. The tail tip containing two nuclei is typically the Brugia malayi is the one. Now these clue cells in a gram stain, the clue cells, what are they suggestive of? They are suggestive of bacterial vaginosis. The endoflagella that you see in spirochetes that help in corkscrew, flexion extension, translatory, all type of movements it will basically help. Now this nutrient agar where you are able to see this golden yellow is typically the Staphylococcus aureus. And this organism in a sexually active young woman with UTI but resistant to novobiosine disc is classically Staphylococcus saprophyticus is what you need to remember. So if you have done this question wrong, no doctor, see how you should prepare is, if you have done this question wrong, immediately go to onlinembbs.com video library. In microbiology, there is a lagatar discussion on streptococci, staphylococci. You should review all the MCQs discussed, theory discussed, and get yourself ready so that next time you should not do a mistake. Like that, every mock test, you correct yourself by choosing 10 to 15 topics by sab log answer kar rahe, main nahi answer kar pa raha hu. That means I need to improve. So that kind of an introspection we need to develop, doctor. Otherwise, the preparation for NEETPG is very easy and very limited if it is very focused. You don't need more than 40-50 days to prepare. Now, use of anticoagulant is done in venous thrombosis. Proton pump inhibitor, omeprazole, CYP2C19 is associated with the metabolism of it. Time-dependent killing is shown by linezolid. So certain antibiotics like beta-lactams, clindamycin, macrolides and linezolid, they can be extensive, they can be very effective because of their extensive amount of time the antibiotic is capable of binding with the microorganism. Microorganism को stick हुए तो उसको शादी कर लेता और छोड़ता नहीं. So that is how time dependent killing is classical feature of the penicillins, cephalosporins, clindamycin, macrolides and linezolid is what you need to remember. Nicomycin, it is not neomycin. Nicomycin, what does it basically do? Question number 154. It inhibits the cell wall synthesis. Nicomycins inhibit the chitin synthase. The UDP N-acetyl glucosamine is the precursor to chitin. Nicomycin is a competitive inhibitor of the chitin synthase is what you need to basically remember. So Dr. Harsha is asking, how can we get all the questions after NEET 2020? I mean this mock test. Very simple, doctor. 9000-868-356. Please call our helpline. In the onlinembbs.com video library, there is an area called as, I'll just show you for the benefit of all of you. Once you go to www.onlinembbs.com, right? So once you go to the onlinembbs.com, the video library, typically there is one area called full-scale mock tests. So all these things are arranged into multiple folders. Once you are given a subscription, you get access to all these folders. They are only being classified in order to make them easy for you to access. That's the whole idea. So in this NEETPG mock test, you have all the mock tests, full-scale grand tests. So since almost 20 years, we have been discussing the questions, right? 2 lakh medical students have had been mentored, and we once upon a time we used to even write the questions. So I'll just give you one example. For example, this is kept for preview. One of the question papers was kept for preview. So typically you have a video lecture. Which is available, and also you have the PowerPoint, and you have the question paper. The question paper is made available over here. After this test is over, our guys will upload the PowerPoint containing all the questions with answers, with the discussion slides, and also you have the question paper available for you to solve, even like a proper online test. And you have the video of the discussion that we are having, and after that video you have the PPT also, you have the PowerPoint also available. So what you can do is, you can be able to go to the PowerPoint, and you can run through the questions quickly. The question with explanatory answer, the PowerPoint will be available over here. So this is how the mock tests are all organized in the onlinembbs.com. But the problem is, if you have to solve a mock test like this in any mock test series, जरा बोर लगता है 3 घंटे बैठ के करना बोले तो. So Kahoot is a way by which you are being given a challenge along with the friends to fight. So after that, all this video that we are discussing now, everything is uploaded along with the PowerPoint into the onlinembbs.com video library. You won't believe, for a throwaway price, you will get an access to this entire video library, entire mock test, entire 2 lakh PowerPoint slides, everything. Even you pay 1 rupee also, we will give activation. You pay 1 lakh rupees also, we will give activation, because we enjoy having as many number of students as so Sureka always has a lot of admiration. In fact, a lot of students across country, because I also sit like a NEETPG aspirant like you, while framing the questions, setting up the question paper, or preparing for a class to discuss with you. So I don't feel like a teacher, I feel like I'm another senior classmate, and I know what are the difficulties for you to understand concepts, because sometimes pharmacology में कुछ inadequacy होता है, और medicine पढ़ाई करने में दिक्कत होता है. Sometimes there will be a little inadequacy or a gap in the anatomy that makes surgery become slightly difficult. So fundamentally, I always imagine that because I also used to have a lot of learning challenges, learning difficulties, attention deficit, all this I suffered as a student. So I know very well what is the student's heart. So Sureka always has a very good admiration. Thank you very much, Sureka, for saying that. Now, let's continue the discussion, doctor. To which family of the chemical mediators lipoxins belong to? They're all arachidonic acid metabolites. The macrophage chemotactic factor, it is a chymotrypsin sensitive factor, and it is fundamentally derived from a human T-cell hybridoma. So this kind of sporadic questions asked, you need not worry. But what is there in examiners? Ninni Kaur is asking how to overcome anxiety about exam. Doctor, what is there to feel anxiety? First tell me, what is there to feel anxiety? Let us हम जरा serious बात करेंगे. Anxiety, why anxiety? किसके लिए anxiety? See, you're already a brilliant medical student. You became a topper. You have 1 billion neurological cells in your brain, right? And you have friends across the country to do a journey along with you. You are a part of a cohort. If you get seat also, nothing will happen, doctor. Suddenly, some miracle doesn't happen. Every year is Bharat mein 30,000 students get into the MD. 30,000 doctors join the MD. We are one among them. That's all. There's no big deal. If we prepare to the concepts with clarity, at least spend 300 hours time. है या नहीं हमारे पास 300 घंटे बोलो है अभी another 60 days time is there 300 घंटे happily है हमारे पास 300 घंटे में बहुत कुछ कर सकते हैं आप 300 hours honestly speaking even if you prepare the entire 1 year also this 300 hours has a great meaning so that is the reason anxiety is only an artificial feeling and it is a necessary evil. It is the anxiety that should drive us to become time conscious and catch up with the cohort, to not lose the focus. It is the anxiety which is the driving force. So that is the reason, don't say that I don't want anxiety. I want to have that element of anxiety to become a driving force. Not only that, after you become MD, when you come out of MD, there are thousands of consultants across. So that is the reason you have to establish as a great consultant, right? So life has every stage a small challenge. So that is the reason we all were mentally prepared when we were becoming medical students itself that we want to take up the challenge at every stage of our life. Tomorrow you may be a top consultant, but you are unable to save a patient. You may be having a patient with a beloved family who already has diffuse metastasis. It's a big disappointment. Life sometimes offers big disappointments. They are the true disappointments that brings a true anxiety. Entrance exam क्या है? Nothing. खेलते खेलते पढ़ना चाहिए. That is very important, right, doc? So very good. So let us kill the questions every day. Every day, morning 9 a.m. to 6 p.m. topic wise, subject wise, classified 500 MCQs. Play with your friends. Go back to the onlineMBBS.com video library, practice them. Next 30 days you will finish 15,000 most essential MCQs, topic wise. Next 30 days. So once that is over, from December 1st onwards, up to January 5th, we will have every day grand test. Morning 10 a.m. to 1 p.m., then lunch break, then 2 hours of discussion. Every day, 35 tests le lo. And keep on improving. Go back to those topics which are high yielding, where you are getting clean bold, and then do the revision in the onlineMBBS.com video library. So that is how every day, रोज एक कदम लगा के हम बहुत बड़े जर्नी खत्म करना है, right? Next 60 days. Yes, Gurumurthy says Kahoot is really helping, sir, and it is an enjoyable exercise. Thank you so much, doctor. It is all you guys. I'm always happy when 100 students are attending, 200 students are taking test. I'll be waiting for that situation. So also tell your friends to also join this live online broadcast self-preparation mode. That is most important. Phagocytosis was discovered by, this is the great man Eli Metchinkov is the one who discovered the phagocytosis, which is a chemoattractant. It is the leukotriene B4 and C5a is a chemoattractant. If you have done this question wrong, immediately jump and finish the topic called complement in microbiology in the onlinembbs.com video library, right? So then next time another question comes on complement, you should not do a mistake. That should be the goal, right? Function of interleukin 4. Interleukin 4 inhibits the interleukin 1. When do you call class 1, class 2, class 3 hemorrhagic shock, doctor? Many times we discuss. Class 1 होता है less than 15% or less than 750 ml. Class 2 होता है 15 to 30%, which is 750 to 1500 ml. Class 3 होता है 30 to 40%, which is 1500 to 2000 ml. And class 4 is more than 40%, which is more than 2 liters of blood loss is class 4. Once more, if you have done this question wrong in the grand test, एक फुटवा ले लो, बट्टी मारने वाला क्वेश्चन है जरूर कल के एग्जाम में एग्जामिनर डिट्टो यही क्वेश्चन पूछेगा. Serotonin is mainly secreted by the platelets, not histamine, serotonin. HLA, pustular psoriasis, HLA B27. Keep punching the answers, doctor. It is once more a reinforcement, and a active, interactive session. Keep punching the answers. So once more, HLA होता है डॉक्टर बट्टे मारने वाला चीज. माइस्थीनिया ग्रेविस का HLA क्या होता है? HLA B8 होता है. इसका फुटवा ले लो. Very important topic. HLA A3. That is what you see in hemochromatosis. HLA B27 in all the seronegative spondyloarthropathies, psoriasis, ankylosing spondylitis, inflammatory bowel disease and Rhetus disease. HLA B8 होता है Graves disease. Don't be late, otherwise you will go to grave. Don't be late. Huh? Late is eight, B8. If you are late, then you are grave. Now, DR2, multiple sclerosis, hay fever, SLE, good pasture. DR3, diabetes type 1. DR4, rheumatoid arthritis, diabetes type 1. DR5, pernicious anemia, Hashimoto's thyroiditis. DR7, steroid responsive nephrotic syndrome. Khatam. Like a Satyanarayana Vratam, you should be ready, doctor. But मार के जाना पड़ता है exam को. There is no shortcut. Fevicol strategy इसको बोलते हैं. You know what is Fevicol strategy? Fevicol strategy. If somebody asks what is strategy to prepare for NEETPG, Fevicol strategy बोलो. Fevicol लगाओ, बैठ जाओ reading room में. सुबह से शाम तक कहीं भी नहीं जाओ, इवन वॉशरूम को भी नहीं जाओ. इसको बोलते हैं फेविकॉल स्ट्रेटजी. दैट इज द ओनली स्ट्रेटजी टू बिकम ए विनर. देयर इज नो सीक्रेट स्ट्रेटजी. सीरम सिकनेस इंजेक्शन विथ फॉरेन सीरम. एंटीरो एंटीबॉडीज typically are seen in subacute cutaneous lupus. Once more, doctor. SLE, what do you see? dsDNA anti-speth. Drug-induced SLE, antihistone. Subacute cutaneous SLE, Rho antibodies which are SSA. Scleroderma, anti-SCL70. Crest, anti-centromere antibody. Mixed connective tissue disorder, RNP. Then poly and dermatomyositis, antijo and Mi2 antibody. Sjogren's, SSRO, SSA which is Rho, SSB which is La. Vaginal होता है सियांका. Microscopic polyangiitis होता है पियांका. बार बार बोलो, हजार बार बोलो, जितना दिल में लगाने तक बोलो. और go back to the exam and reproduce. One question आने वाला है. Then one more important thing, In case of rheumatoid arthritis, the most specific antibody होता है anti-CCP, cyclic citrulinated peptide, is what you need to remember. Similarly, SLE में anti-Smith, dsDNA, ANA. Drug-induced lupus में antihistone. Sjogren's, you have Rho and La. That is what you have to emphatically remember. Now comes the NK cells. Once more, NK cells are sitting in the examiner's question bank. So be very sure they are derived from the large granular cells is what you have to basically remember. Now, post-transplant rejection, it is the HLA antigen which is associated. Surface immunoglobulin is a feature of B cell. HLA2 is associated with graft versus host disease. By a transplant rejection, how many types of reactions that you know? Hyperacute, acute, chronic, graft versus host disease. Why do you get hyperacute? Why do you get hyperacute reaction? Typically, before going to transplant, if the patient is receiving for the anemia, generally renal failure patient is undergoing renal transplant. So before undergoing renal transplant, he was undergoing a lot of blood transfusions because chronic renal failure led to anemia. Anemia के लिए transfusion दे रहे. So transfusions ले रहे तो transfusion will only match ABO blood group. There are many unmatched histo-incompatibility factors that will be there between two people blood. So all that will lead to sensitization, allosensitization, and that lead to lot of antibodies inside his body ready. Then if you put the graft, if you happen to put the graft, then the graft will be immediately attacked by the preformed antibodies. Preformed antibodies, that is called hyperacute rejection. So it is antibody mediated type 2 preformed antibodies. It occludes the blood vessels and lead to ischemic necrosis. Acute rejection hota hai within weeks. It is cell mediated by the cytotoxic T lymphocytes, and you can decrease that by giving OKT3, cyclosporin, etc. etc. And chronic rejection is also T cell and also antibody mediated. It is class 1 MHC is the one which is responsible. Then graft versus host disease means the graft which you are placing in the host, the recipient के अंदर आप डोनर का किडनी लगा रहे, डोनर का बोन मैरो लाके होस्ट में लगा रहे, तो वो जो donor ka organ, whatever it is there, it has got, for example, immunocompetent cells inside it. Then the moment you put it in the body of the patient, it will immediately start attacking the various tissues of the recipient, otherwise called host. That is what you need to remember. So GVHD ko, how can you be able to prevent? The particular organ which you are bringing and putting into the recipient, irradiate it properly so that you kill all the immune cells inside it. That is what you need to understand. Now, what is the most common site of the brain metastasis? Good to see Ghana Prakash. Gnana Prakash, yes. Gnana, Ajay, Maurya, Jagadishwar, Ammaji, you all have become part of my daily life, right? Without meeting you guys, without talking with you guys, the day doesn't pass, right? Once upon a time, last year, I used to have Ravi Kumar and all this. That was another big time gang, right? And years pass, some of the students, a good number of them get the seat, they become topper, they are all now doing very busily residency. Some of my students are head of the department also, right? They are the top consultants, heads of the department. Other day I met one of a cardiologist in Bangalore. 20 years back when I was teaching, running a center on MG Road in Bangalore, he was my student and now he is the head of cardiology. It's a great pleasure, right? So, most common site of the brain metastasis hota hai cerebrum. So, always have that dream doctor. You will also become top consultants, etc., etc. Right? Now, most common cause of meningoencephalitis in children, enterovirus. A child presents with mental retardation, hypopigmented patches, typically a case of tuberculosis, subependymal calcified nodules. Where do you see? Typically in tuberculosis. So if you take tuberculosis, subependymal calcified nodules are the classical feature in the caudate nucleus and thalamus. Between that two, in that groove of the lateral ventricles, you have these subependymal nodules, is what you should remember. Now, excessive eating of non-nutritive substances, dirt, ice, that is called pica. A child presents with cough, coryza, increased temperature, red maculopapular rash, that is measles. Most common complication, not most severe, most common complication, that is the trick. It is otitis media. So any recurrent common cold, upper respiratory infection, exanthematous infections, measles, diphtheria, whooping cough, they are the predisposing factors for the development of the otitis media, is what you need to remember. Pulmonary hyperplasia with urinary problems, what is that called? Potter's syndrome. So typically Potter's syndrome is seen in the case of oligohydramnios. There is the ocular hypertelorism, prominent skin fold, large flattened ears, micrognathia, mandibular asymmetry, cleft lip, cleft palate and microphthalmia. That signifies the Potter's syndrome. You can easily remember. P, pulmonary hyperplasia. O, oligohydramnios. T, wrinkled skin, that is twisted skin. T, twisted face, Potter's faces. Then E, extremities defect. And R is the renal agenesis. So common MCQ asked in the exam is oligo, not poly, oligohydramnios, renal agenesis. You should remember Potter's syndrome. Now, doctor, dyslexia. It is the most common learning disability. That is, inability to read is the most common learning disability. Complete absence of glucuronide transferase is type 1. Partial is type 2. Partial is type 2. Right? Then, which is used to assess the deafness in infant, auditory brainstem response, because infant cannot tell whether he is hearing or not. So, objective tests have no role. Subjective tests have no role. You have to do a objective test like auditory brainstem response. This is very important, doctor. Question number 180. Please punch your answers, doctor. Please punch your answers. This question is for a bed. Come on. Devayan Day says eustachian tube dysfunction. Himanshu proposes stapedectomy. Ajay Maurya, clean bold. Very good. Shivendra Rai, Vishnu Priya, and Shamala. Absolutely. After stapedectomy, that is whenever there is any ossicular chain discontinuity, it leads to AD kind of curve. So if you have done this question wrong, doctor, once more go back to the onlinemmbbs.com video library. Right? Tympanometry is a topic which is waiting for your attention. Please quickly review. You will take only 10 minutes. But you need to make it a point that you do the revision, and then next time you should not do a mistake on this topic. So let me tell you all, and also you can tell your friends, December 1st to January 5th. Okay, doc? Morning 10 a.m. to 1 p.m. you will have a full scale grand test every day. 35 grand test खेलेंगे, खेल के डिस्कस भी करेंगे. From December 1st शुरू करेंगे. By December 1st you finish all your preparation, doctor. Then 1:30 to 3:30 or 4 p.m. we will have a discussion every day. End of the discussion you pick up 10-15 topics, go back and repair them, those which you have done wrong. 35 grand tests every day, 10-15 topics. If you are able to after the exam is over, if you are able to get inspired to do the revision in the onlineMBBS.com video library, more than enough, doctor. You will become the winner, right? We'll start from December 1st. But before December 1st, this next 30 days, November, in this month of November, every day 9 a.m. to 6 p.m. you have 500 MCQs, topic-wise, subject-wise, topic-wise classified. Every topic there is a quiz, Kahoot, 9 to 10, 1 hour break, 11 to 12, 1 hour break, 2 to 3, 1 hour break, and 4 to 5. So totally 5 hours with 1 hour break in the middle, and you get 500 MCQs to solve. So play it like a quiz, know where is your basic knowledge and then improve upon it. So that's how we will do the revision up to December 1st. So please join along with your friends for playing the Kahoot quiz, right? Kahoot quiz. And then know which topics you are naturally strong, where you are really lagging behind, and complete all 953 topics in the next 30 days. 15,000 questions, 20,000 questions, every day 500 MCQs. Then from December 1st onwards, 35 days we will be having time. That time, every day one full scale grand test and have a discussion with Dr. Murli. So that is a goal. Type AS, it is often associated with ossicular fixation or temporomandibular scarring, but the eustachian function is normal in them. So type A is normal, doctor. Type AS is normal but shallow. Type AD is disarticulated or a flaccid tympanic membrane. Type B is abnormal reduced eardrum mobility. Type C is a abnormal negative pressure. So you should be quite sure to recognize. Eagle syndrome, typically stylalgia, stylomastoid foramen area mein pain. Hearing loss of Meniere's is a fluctuating sensorineural hearing loss, right, doctor? Now, halo sign, if you want to differentiate what is coming out of the nose is a common cold mucus or a CSF rhinorrhea. Typically in the rainy season only people will skid on the bike. Then there is a worry whether what is leaking out of the nose is the mucus or CSF. Halo sign on the handkerchief will help to identify the CSF rhinorrhea is what you need to remember. A person hearing two different tones in the left and right ear when presented with the single tone, what is that called as? It's called binaural dysplasia. Frey syndrome is because of the auriculotemporal nerve, all of you know this. Conductive hearing loss is seen in CSOA motor sclerosis and serous otitis media. Nasal myiasis is treated with chloroform water. To know the nasal mucociliary clearance, we use a saccharin test. Nasal myiasis presents with severe irritation with sneezing. What is Bellin syndrome, doctor? Bilateral parietal lobe dysfunction. is called Bellins. In that you get optic ataxia, simultagnosia, ocular apraxia. What is the meaning of simultagnosia? You ask the patient to close the eyes. You touch only on one arm and say, are you able to feel? Ask him which side is he feeling. He will tell. Then you use the two fingers and once more touch him. So he will not be able to identify when simultaneously if you are touching him, which is called simultagnosia, which is seen in bilateral parietal lobe dysfunction in Bellin syndrome. So once more tell me, doctor, what are the triad of clinical features of Bellin's? Optic ataxia, ocular apraxia and simultagnosia. And why does it happen? It happens because of the bilateral parietal lobe lesion is what you need to remember. And it is object based, not location based, right? Then miliary TB. MANTO is not always positive. Whenever in MCQs, doctor, always means that is the wrong answer. Always it is the correct answer in except based questions. There is nothing like I will always love you, I will always live with you like your dog, I will be loyal with you. They're all marriage vows. They really don't stand true. Always, right? So always is a odd man out. Somebody says, always I'll be with you, no guarantee, right? So, yeah, but I will be always with you. Let me tell you, every day 2 hours I will discuss with you up to NEETPG, because I don't get sleep if I don't take a class for you for 2 hours. That is my problem, right? Now, miliary TB, it occurs in primary infection. It may occur following secondary reactivation, and sputum microscopy is usually negative in case of miliary TB. So where do we use intravenous immunoglobulin, doctor? In case of the Kawasaki, ITP, CLL, in all this there is a role for IV immunoglobulin. Weber syndrome, Nott-Nagel syndrome, Calot syndrome. Are you ready? About brainstem syndromes. Favorite question, doctor. If you have done this question wrong, first punch your answers, doctor. Question number 193. मैं देखता हूँ कितने लोग right किया है इस question का answer. Question number 193. Please punch your answer, doctor. If you have done this question wrong, doctor, you have to really get serious. Go back to the onlinemmbbs.com video library and do the revision. Amit Jain is proposing D. Chinnappa is saying diplopia. Padma is saying diplopia. Sureka, Jagadishwar, Visalakshi. वाह, कितना पुण्य मिलता है आप सबका स्मरण करके मुझे. Wow. So most common wrong answer is diplopia. Have you identified now? First of all, diplopia, why do you get? If your extraocular muscles are affected. So what nerve supply? Third, fourth, sixth supply extraocular muscles. Weber involves midbrain. So what are the cranial nerve nuclei you have in midbrain, doctor? Third, fourth. In Pons, you have fifth, sixth, seventh. And in medulla, 8th, 9th, 10th, 11th. So when midbrain is involved, third is involved. If third is involved, you have diplopia. You have ipsilateral oculomotor palsy. That itself will lead to diplopia, na doctor? And it leads to contralateral hemiplegia, because if you look at the corticospinal tract, it is descending through the midbrain, pons, medulla. In the medulla, it is going to opposite side. So if you have a lesion in the right side, midbrain, then typically it will lead to hemiplegia on the left side. So hemiplegia will be contralateral, oculomotor will be ipsilateral, there will be diplopia, but because it is midbrain, facial nerve is not involved, is what you need to remember. So you have please review this important topic of brainstem syndrome, doctor. Weber's syndrome, third nerve palsy on ipsilateral side due to oculomotor nerve, hemiplegia on the contralateral side because of the superior cerebral peduncle involvement is Weber. Claude क्या है? Ipsilateral third nerve palsy, but contralateral ataxia and tremor. Contralateral opposite side, ataxia and tremor. So typically if you look at the midbrain, doctor, midbrain में there is something called red nucleus. So you have cerebellum, you have the spinal cord, all sensory information pass through the spinal cord. In the medulla it will reach inferior olivary nucleus. From inferior olivary nucleus it will go to, through the inferior cerebellar peduncle, it will be going to cerebellum. And from cerebellum through superior cerebellar peduncle, it will go to the midbrain. And it will report to red nucleus. Red nucleus will report to thalamus. Thalamus will report to sensory cortex. So this is called dentato. It is the dentate nucleus which is the efferent. Dentato, rubro, thalamo, cortical pathway. It is called as. So whenever Claude syndrome is happening, midbrain is involved, and even this superior cerebellar peduncle is also affected. So that is the reason the red nucleus get affected. Red nucleus it is not getting communication from cerebellum. It is not getting communication. That is the reason you get tremor. Because the superior cerebellar peduncle and red nucleus involvement, that is called Claude syndrome. Then what is Benedict syndrome? Benedict is only red nucleus involvement. So third nerve palsy, ipsilateral and contralateral side, tremor only, not ataxia. Tremor only because of the red nucleus involvement, not the peduncle involvement. Cerebellar peduncle is not involved, but only red nucleus is involved. That is the Benedict syndrome. That is what you should understand. So always, doctor, if you look the pons and medulla, this structure, suppose this is a globular structure. If you look at the medulla, so each half is divided into two parts, lateral, medial. Similarly, medial and here lateral. So there are certain structures in the lateral part of the pons. There are some structures in the lateral part of the medulla, so you must be very sure about it. So in the lateral part of the pons, you have four tracts: lateral lemniscus associated with our auditory pathway. Vestibular connections are in the lateral part of the pons. Then you have reticulospinal tract, spinothalamic tract, they are all in the lateral pons. Then what are the cranial nuclei which are there in the lateral aspect of the pons, doctor? Cranial nerve 5, cranial nerve 7 and also 8. Then medulla laterally, what are they? You have spinothalamic, reticulospinal, vestibular connection, cerebellar connections, they are all in the lateral part of the medulla. Whereas cranial nerve 5, 7, 9, 10, they are all there in the medial aspect of the medulla. So, to say, they are all the cranial nerve nuclei in the lateral aspect of medulla, right? Only cranial 10, 12, cranial 12 is there along the medial aspect of the medulla, is what you should remember. Okay, doc? So, जरा आराम से पढ़ाई करो, टेंशन नहीं है, मगर ब्रेनस्टेम सिंड्रोम का आंसर आप रॉन्ग करें तो डॉक्टर मुरली भरद्वाज रोएगा, right? My soul will be heaving with unrest in the grave if you happen to do a brainstem syndrome question wrong, right? You should not do. So doctor, if you look at the midbrain ventral aspect, if there is any lesion, that is called Weber. Then dorsal aspect of the midbrain, Parinod syndrome. What happens in Parinod syndrome? Typically in the dorsal aspect of the midbrain, you are having the centers required for our vertical gauge. So the vertical gauge get affected. Person cannot look down. So he will be frequently falling down if he is having Parinod syndrome, because vertical gauge center is located in the dorsal midbrain, and that is the one which get involved whenever there is Parinod syndrome. Now, what are the inclusion bodies in progressive myoclonic epilepsy, doc? Typically, they are the Lephera bodies. All bodies you should be sure. Lewy bodies typically look like this. So tell me, doctor, what are all the bodies that you know? Negri body is a cytoplasmic viral RNA. Batti marne wala area hai. Please take a screenshot and keep it in the mind. Right? Ravismin. Hirano body, they are cytoplasmic aggregates of actin and actin associated proteins. Alzheimer's disease, you find Hirano. Lewy body, alpha-synuclein, ubiquitin, neurofilament proteins. And typically they are seen in Parkinson's and Lewy body dementia. Pick body, they are tau proteins and typically found in frontotemporal dementia of Pick. Lephora bodies, they are the cytoplasmic polyglucosan, that is the abnormal form of the glycogen, and typically found in Lephera's disease, which is a progressive myoclonic epilepsy, is what you should understand. So these are the Samoma bodies. They will be seen in meningioma. Pick bodies typically contain tau protein. So a little bit about inclusion bodies you have to be very sure about, doctor. Now, Hashimoto encephalopathy. They have myoclonus, seizures, steroid responsive encephalopathy, and EEG looks abnormal in Hashimoto encephalopathy. So it is acute or subacute with cognitive impairment, psychiatric symptoms, involuntary movements, seizures. Myoclonus, adolescent females are most commonly affected. So how do you treat Hashimoto encephalopathy? They are steroid responsive. You have to give steroids. So the blindness in a diabetic patient increases the chance at 25 times higher. If you are giving the resin, sodium polystyrene sulfonate, what is one of the complications? It can lead to intestinal necrosis. Intestinal necrosis. How much of potassium maximum delivered with a central vein? Potassium is corrosive when you are injecting. So 60 millimoles per liter. After human bite, the best way is ampicillin plus sulbactam. Crista terminalis is a part of the right atrium. It is that smooth surface, a thick portion, crescent shaped in the right atrial appendage. And Crista terminalis will divide. The Crista terminalis divides the right atrium into a rough anterior part that has Crista terminalis and pectinate muscles, and a smooth posterior part which has got fossa ovalis and coronary sinus is what you should remember. Now, doctor, hemiazygous vein. What is true and accept about it? So, it pierces left crus, drains esophageal vein, at T8 level drains into azygous vein. That is all the true statement. Then what are the tributaries of the hemiazygous vein? What combine to form hemiazygous? Left ascending lumbar vein, left subcostal vein, lower 3 to 4 intercostal veins on the left side, righto, lefto. Be very sure about. So examiner is trying to zigzag you by proposing right. No, hemiazygous. Left, little. So it pierces left crus of diaphragm. It descends on the left side of the vertebral column, and at the T8 level, it goes towards the right. Right. It passes beneath the aorta, esophagus, thoracic duct and joins the azygous vein is what you need to remember. Azygous vein, where does it drain into? It drains into superior vena cava. The SA node has got right coronary, which is the blood supply. Apex of the heart is formed by the left ventricle. I'll try to go really fast. My intention is, the intention of the test discussion is quickly to run through the questions. Some questions require a little detailed review, right? And finish as many questions together. And you identified 10-15 topics, pakad lena, which you are really doing wrong. And then in the evening, before you go to sleep, you should see that those 10 to 15 topics go last nail in coffin, laga dena, and say goodbye to them. Uttana perfectly padke next mock test mein. You should not do a mistake in those set of topics. Like that, every grand test, if you can improve by 10 to 15 topics, 35 grand tests from December 1st to January 5th should make you hot masala NEETPG aspirants. Right, doc? Very good. Now, anterior surface of the ventricle, immediately below the sternum, what is there? You are having the right ventricle. That's the reason whenever steering injuries made, right ventricle is the one which is injured. All left chambers are all posterior. So whenever mitral stenosis is there, I'm talking, this is the lateral view, samjho. This is sternum, samjho. So left atrial enlargement will cause the esophagus to get compressed. So that is how you get dysphagia with the left atrial dilatation. Left atrial dilatation also will lead to what? Splaying of the carina. The tracheal bifurcation is there, no? That become more wide angled when the left atrium happened to enlarge posteriorly is what you should remember. Sternocostal surface of the heart is formed by right ventricle, right auricle and left ventricle. Third coronary artery kisko bolte? Conus artery. Conus is a branch of right coronary. Right coronary has got a conus branch, SA nodal branch, marginal artery, posterior descending interventricular artery and AV nodal branch. AV nodal branch also. Now anterior division, posterior division of internal iliac artery. Let me check. Punch your answers, doctor. Question number 209. Shoot. Yes. Please punch your answers, doctor. So, I'm looking for your answers. Very good. Devayan proposes C. Sureka thinks D. Amit Jain thinks B. Visalakshi proposes D. Right. So, today evening, I have two very close friends. One guy is a nephrologist, top nephrologist, Dr. Gangadhar, and I have another neurosurgeon. We are all from the medical college, day one, we are all preparing together, studying together. So we decided every Sunday evening, 1 hour, let us do go to the gym, right? So instead of meeting for eating, meeting for eating is the worst way to meet friends. Whereas meet them for a bit of physical exercise is the best way. So when you are preparing for entrance, 2-3 friends जिसके साथ इतना बंधन हो जाता, throughout life they will be your companions. Everything else in the life will be acquaintance. So when tomorrow you become top consultants, you will remember when you will also become 45 like me. Then that time you will remember that during PG preparation days, there was no money to eat. Now we are afraid to eat, right? So that is the whole challenge of life. So good doctor, not a branch of anterior division. D is the correct answer. Ajay, Maurya, Ammaji, Devayan, Ritvik, Visalakshi, you're all right. Doctor, you like it, you don't like it, you hate it, still you need to remember it for the NEETPG. What are the branches of anterior division? Superior vesical, obturator, middle rectal and inferior vesical, inferior gluteal and internal pudendal. Internal pudendal. They are all the branches of the anterior division. So obviously options में examiner क्या देता है? One of the posterior division branch को बिठाता है. So if you don't have energy to remember the anterior division का इतना number of branches, कोई दिक्कत नहीं. खाली 3 branches of the posterior division of the internal iliac का याद रखो ताकि eliminate करके entrance में answer correctly कर सकते. So iliolumbar, lateral sacral, superior gluteal, they are the 3 branches of the posterior division. Pills, P is posterior division, I, iliolumbar, L, lateral sacral, S, superior gluteal, they are the part of the posterior division. So in the online mbbs.com video library, there is a topic called arteries in anatomy. So all MCQs asked in the DNB, PGI, AIMS, all these exams on arteries are made available. So please do take an opportunity to do the revision if you have done that question wrong. Internal pudendal is a branch of internal iliac. Thoracolumbar fascia typically gives origin to lateral arcuate ligament. So भैया इसमें जरा टेंशन है, क्या है? How is diaphragm created? There are 3 arcuate ligaments that lead to the diaphragm. Median arcuate, medial arcuate, lateral arcuate, median arcuate ligament. Basically, it is a tendinous arch which is connecting the right and left crura. Median जो होता है आपका ये median, यहाँ देख रहे हैं ना, median जो होता है, it connects the right and left crura. Medial on each side of the diaphragm, connecting the each crus to the tip of the transverse process of the first lumbar vertebra. You have the medial arcuate ligament, then lateral arcuate ligament. On each side connecting the tip of the transverse process of the L1 with the last rib, you have the lateral arcuate ligament. So इसमें medial arcuate ligament जो है, it is not the one, it is the lateral arcuate ligament which is derived from the thoracolumbar fascia. Thoracolumbar fascia is that fascia in which all our muscles in the back are all nicely packed, right? So that is the story of arcuate ligaments, doctor, right? So thoracolumbar fascia is a deep fascia. There's a lumbar part, and laterally it gives origin to the transverse abdominis and internal oblique. And medially it splits into 3 lamellae of layers. Anterior plus middle layer, they extend superiorly to the last rib and inferiorly to the iliac crest. And posterior layer, it extends upwards towards thorax and neck. So that is the thoracolumbar fascia, which gives origin to the lateral arcuate ligament is what you need to remember. Now doctor, internal spermatic fascia is a derivative of fascia transversalis. Esophagus को serosa नहीं रहता है, there is no serosa. That is the reason esophageal tumors can easily disseminated across the mediastinum because there is no serosa to prevent the metastasis. That's the point you need to appreciate. This is a beautiful question, doctor. Nerve supply of anal canal above pectinate, below pectinate is a favorite question. So above pectinate is all autonomic nervous supply, not somatic nerves. Right gastric node drain, it's a very common sense question. Stomach has got lesser curvature, greater curvature. So obviously right gastric nodes have an access to lesser curvature. Left gastric nodes have an access to greater curvature. That's what you need to remember. So what is the lymphatic drainage of the stomach, doctor? You have a superior gastric, suprapyloric, pancreatico-renal towards spleen, and inferior gastric subpyloric area. And all of them ultimately drain into celiac group of lymph nodes and into the thoracic duct is what you should remember. Now doctor, Gerlach valve, where is it present? In the vermiform appendix. Adult testis kitna hota hai? 15 to 20 ml. Length of the lower esophageal sphincter 3 to 4 centimeters. Wow. Examiner, kaun banega PG Pati program. After entrance is over, you forget all these things, doctor. Internal rectal venous plexus. Where does it drain into? It drains into superior rectal vein. Now doctor, rectum, anatomy of the rectum is a favorite topic of the examiner. Bhaiya, rectum ka length kitna hai? 5 inches, 13 centimeters. From S3 vertebra, it begins in front of the S3 vertebra as an extension of the sigmoid colon. S3 vertebra, please don't forget anatomical level, starting point for the rectum. It has got 3 lateral curves, upper convex to the right, S3 and 4 vertebra, middle convex to the left at the SC junction, and the lower is convex to the right, tip of coccyx. Then if you look at peritoneum of the rectum, is the rectum fully covered with peritoneum? No sir. In the first 1/3 of the rectum, anterior, aage or lateral surfaces are covered. Middle 1/3, only anterior surface is covered. That is what you have to remember. Then what is the blood supply of rectum? Superior rectal artery, branch of inferior mesenteric artery. It supplies the mucous membrane, is what you need to remember. And this superior rectal artery, which is the branch of inferior mesenteric artery, will come down and anastomose with middle and inferior rectal arteries. Then the middle rectal artery is a branch of the internal iliac artery and it mainly supplies muscular cord. Inferior rectal artery is a branch of internal pudendal artery and it anastomoses with the middle rectal artery at the anorectal junction. That's what you should remember. Then how is the venous drainage? Superior rectal vein is a tributary of the portal circulation and drains into inferior mesenteric vein. Inferior mesenteric vein contributes for the portal circulation. So, superior rectal vein drains into inferior mesenteric vein and goes into portal circulation. So, fundamentally, mesenteric vein, splenic vein together will form portal vein. Right? So mesenteric circulation का में drain होने वाला क्या है? Superior rectal vein, that is portal component. Whereas the middle and inferior rectal veins, the middle and inferior rectal veins, they drain into internal iliac, internal pudendal veins, which are the systemic circulation. So that is how you find a portosystemic anastomosis focusing on the rectum is what you should remember. So you have a similar kind of contribution, one vein draining into portal, another draining into the systemic in esophagus, anal canal, paraumbilical area, retroperitoneal and intrahepatic. So, how are the lymphatics of the rectum, doctor? The lymph vessels accompany the superior rectal artery and drain into inferior mesenteric nodes. And the lower part follow the middle rectal artery and they go to the internal iliac group of lymph nodes. Similarly, what is the nerve supply? Autonomic nerve supply. Anything above pectinate line of the anus, rectum and anus typically is autonomic, sympathetic, parasympathetic. So parasympathetic supply of the rectum is pelvic splanchnic nerves S1, 2, 3 and sympathetic hota hai superior hypogastric plexus which is L12. That's what you need to remember. L1 and 2, sorry, L1 and 2. Now, Calot's triangle, what is the content? Cystic lymph node. So you should remember, what are the boundaries of the Calot's triangle, doctor? Liver ka niche kya hai? Calot's triangle. Under surface of the liver is superior body. Then hepatic duct, common hepatic duct is on the left side. Cystic duct is on the right side. So this is the how you recognize. And what is the content of it? Cystic artery and vein and cystic lymph node. Cystic lymph node is what you should remember. Left ovarian artery is a branch of aorta. Muscles of the nose does not include angular oris. Lateral wall of the nose lymphatic drainage is deep nodes in the cervical area, retropharyngeal and submandibular nodes. Lymph from the nose goes to submandibular, retropharyngeal and upper deep cervical nodes. Receptor potential is a graded change. Stretch reflex, reflex arc. You have an alpha motor neuron in the spinal cord that will go and supply the muscle, and the stretch of the muscle through the Golgi tendon organ is being informed back to the spinal cord. This reflex arc is the unit of the stretch reflex. How does calcium play a role in smooth muscle contraction? There is a muscle light chain kinase. It will lead to activation of this muscle light chain, myosin light chain kinase. Now doctor, REM sleep is 20% of the total sleep. Peripheral chemoreceptors, their stimulation lead to tachycardia, it lead to vasoconstriction. What is the main regulator of our chemoreceptors? It is not PaCO2, it is the H plus ion. CO2 combines with water to form carbonic acid from which H plus ion is released. That has an entry into the blood-brain barrier and it is the primary regulator of the chemical central chemoreceptors is what you should remember. How does carbon dioxide diffuse readily? Because of its high solubility coefficient and high diffusion coefficient. In a high altitude acclimatization, high altitude mein, hemoglobin will start delivering more oxygen to the tissue. It loses the affinity. It loses the affinity for oxygen. When gases flow through an orifice, what affects the turbulence, density, viscosity and diameter of the orifice? 1 mole of myoglobin binds with 1 molecule of oxygen unlike hemoglobin. Thickening of the respiratory membrane is a feature seen in pneumonia. Beautiful question. If the diameter of the vessel is increased double, what is the effect of it? Question number 236, फटाफट answer दे दो doctor. Let me check. What is your answer? If diameter of the vessel is increased double, then what do you get? What happens? Please punch your answers, doctor. Yeah. Please punch your answers. Yes. Should your answers, doctor? Yes. So I can see C. Most of you are saying C. Beautiful. 16-fold. 16-fold. So you know very well the flow rate is proportional to pressure difference into radius to the power of 4 divided by 8 into viscosity into length is what you should remember. During underwater diving, the main danger is what? It is oxygen and nitrogen. Suddenly you will start getting the bubbles of nitrogen, right? The amount of the blood in the capillary pool any given time is around 1/4 of a liter. What are the most important factors that maintains intravascular fluid volume? It is the osmotic pressure in the capillaries, which is a deciding factor. Wind-Kessel's effect in large arteries. What is their main purpose? See, doctor, you have the heart. From the left ventricle, the blood is going into aorta. So what did left ventricle do? With a lot of pressure, it pushed the blood into the root of aorta. Agreed? That made aorta, which is an elastic artery, to undergo distension. Then, after that, the aortic valve closed. Then what should happen to the blood here? It reached till this point because of the push given by the left ventricle. But beyond it, it needs to go throughout the body. How will that happen? This distended aorta will have a elastic recoil, and that pushes the blood throughout our body. Right? Anytime आप plants को watering किया क्या? Long tube लगा के garden में. Similar to that. Wind-Kessel's effect is all about preventing fluctuation in the pressure of the blood in the peripheral circulation. Even though heart is no more causing that push, it is the elastic recoil of the distended blood vessel that is the pushing force for the blood to reach the peripheral circulation is what you need to remember. That's called Wind-Kessel's effect. So what is cerebral perfusion pressure, doctor? Arterial pressure minus intracranial pressure. A wave, C wave, V wave, they're all positive waves. X is descent. Simplest question actually. So don't forget, doctor, JVP. Without JVP, अगर NEET PG 2020 हुए तो मेरा नाम मुरली भरद्वाज नहीं है, right? Definitely one question is going to come on JVP, doctor. Take it as my word, right? Somewhere in online it showed answer as only nitrogen. It is both oxygen plus nitrogen, doctor. Why? Oxygen and nitrogen, right? Now let's go to the next question. L-alanine is replaced by D-alanine. What will happen? That will interrupt the entire structure. Primary structure of any protein is what, doctor? The amino acid sequence is called primary. Acidic property of the alpha carbon of the amino acid is all because of the carboxyl group. Histidine is most important for buffering in normal conditions because the pKa value of the histidine is similar to the physiological pH of 7.3. Transamination reaction. There is an alpha amino group. From alpha amino acid to a keto acid, it gets transferred. Alpha ketoglutarate is the one which is most commonly receiving the amino group. Threonine does not undergo transamination. They're all true. Biotin is needed for what? Biotin is required for carboxylation reactions. That's the point you need to appreciate. Imidazole ring is there in the case of the histidine. Edmonds reagent is phenyl isocyanate. क्रिएटिनिन की पिताजी कौन है? आर्जिनिन. Arginine plus glycine, they form guanidoacetate. Guanidoacetate become creatine by action of the guanidoacetate methyl transferase. Creatine in turn will become creatine phosphate. Arginosuccinate. Once more, urea cycle बराबर सीखना पड़ता डॉक्टर. If you have done this question wrong, you need to go back to the onlinembbs.com video library. So citrulline and aspartate, it is the arginosuccinate is synthesized. What is hyperammonemia type 1, hyperammonemia type 2? You should be very sure. Come on. Punch your answer, doctor. Let me see how many of you are right. Question number 251. 251. Punch your answer, doctor. Yes. Vishnu Priya proposes carbamyl phosphate synthase 1. Everybody else, please punch your answer. आजकल तो हमको काहूट इतना आदत बन गए, हम स्मार्टफोन के लिए देख रहे कहाँ पंच करना. भैया YouTube chat also is a good place for punching, right? हाँ. So doctor, it is CPS1. Very good. Hyperammonemia type 1 is carbamyl phosphate synthase 1. Type 2 is ornithine transcarbamylase. Citrullinemia is because of the arginosuccinate synthetase deficiency. Arginosuccinic acid urea is because of the arginosuccinates. Hyperarginemia is because of the arginase deficiency. Be very sure. Very sure. Always urea cycle mein, what is the rule, doctor? The enzymes in the early part of the urea cycle, if they are affected only, you get hyperammonemia. Urea cycle mein late enzymes do not cause that much a significant hyperammonemia. So what is the deficiency typically is associated with type 2? You can remember. Type 2 is OTC deficiency. Right? Then now doctor, ammonia in the brain is trapped by glutamine. So whenever your liver is not working, when you get hyperammonemia, why do you go into encephalopathy? What is the reason for that? Typically, ammonia in the brain is combines with glutamate to form glutamine. Typically, ammonia plus glutamate form glutamine in the brain. So if lot of ammonia is there, lot of glutamate become consumed. From where is glutamate formed? It is formed from alpha-ketoglutarate. Alpha-ketoglutarate is a part of citric acid cycle. So that is the reason when person has too much hyperammonemia in the brain, all the alpha-ketoglutarate in citric acid cycle is consumed to form glutamate. That makes citric acid cycle no more to work. That is the reason person get encephalopathy in hyperammonemia, because in the brain, one of the role of the citric acid cycle is to provide the alpha-ketoglutarate, to create the glutamate, to detoxify the ammonia, to convert that into glutamine is what you need to understand. Oxidative deamination, it requires NAD. Of all these, pentose phosphate pathway is a anabolic cycle. Its purpose is not to produce ATPs. So it is an alternative to glycolysis and citric acid cycle to oxidize the glucose, but it is more anabolic in nature. Acridinosis is due to deficiency of homogentisate oxidase. What is the most serious form of rickettsial disease, doctor? Rocky Mountain Spotted Fever. Levinthal Colli Lilly body. With this, we will call it a day, doctor. It is typically seen in case of Sitaki, is what you should Remember. So, खेलते खेलते हम मिलके पढ़ाई करेंगे. There are 20,000 MCQs, every day 500 MCQs, topic wise classified, and up to November 30, every day 500 MCQs, morning 9 a.m. to 6 p.m. Play Kahoot quizzes, know where you are going wrong, and then what are your strong topics, weak topics, everything. And from December 1st to January 5th, we will have every day 10 to 2 p.m. grand test and 2 to 4 p.m. discussion. 35 grand test discuss करेंगे December 1st to January 5th तक. And please call our helpline 9000868356. Become part of our WhatsApp study group. We have around 20,000 students who are part of our WhatsApp study groups in NEETPG, in around 80 groups. You also get included into them, and then you have a lot of friends who will be your study partners. And also subscribe to onlinembbs.com video library for the next 60 days up to the NEETPG exam. So good luck to all of you. I hope you all have filled your online application of the NEETPG and getting fully with that great dream that you are going to become MD residents by January. Good luck. Enjoy a great Sunday. Thank you.